Pekin ducks are prolific layers and their eggs are a delicious and nutritious addition to any kitchen. If you're raising Pekin ducks or considering it, here's everything you need to know about their eggs, from laying habits to culinary uses. Laying-age Pekin ducks typically start laying eggs at 5 to 6 months old. Egg quantity: they can lay 200 to 300 eggs per year depending on their diet, environment and overall health. Seasonality: ducks lay more eggs during the spring and summer when daylight hours are longer. Egg production may decrease or stop during the winter. Size. Pekin duck eggs are larger than chicken eggs, weighing about 90 to 100 grams, or 3 to 3.5 ounces each. Color: the shells are typically white or off-white yolk. Duck eggs have a larger, richer yolk compared to chicken eggs with a higher fat content. Albumin or egg white: the egg white is thicker and contains more protein than chicken eggs. Duck eggs are highly nutritious and offer several health benefits. They contain more fat and protein than chicken eggs, making them more filling and energy-dense. Duck eggs are an excellent source of vitamin B12, selenium and choline, which support brain health and metabolism. If ducks are fed a diet rich in omega-3 fatty acids, like flaxseed, their eggs will have higher levels of these healthy fats. Duck eggs are versatile and can be used in many recipes. Their rich yolks and thick whites make them ideal for baking, producing moist and fluffy cakes, cookies and pastries. Duck eggs have a richer flavor than chicken eggs, making them a delicious option for breakfast dishes when fried or scrambled. Hard-boiled duck eggs are creamy and satisfying, though they may take slightly longer to cook than chicken eggs. Duck eggs are also excellent for pickling due to their size and texture. Collect eggs daily to prevent them from getting dirty or cracked. Ducks often lay eggs early in the morning. If eggs are dirty, gently clean them with a damp cloth or sandpaper. Avoid washing them with water, as this can remove the protective bloom and make them more susceptible to bacteria. Store eggs in the refrigerator at 40 degrees Fahrenheit or 4 degrees Celsius or below. They can last up to 6 weeks when stored properly. If you want to hatch Pekin duck eggs, here's what you need to know. The incubation period for Pekin duck eggs is 28 days. Maintain an incubator temperature of 99.5 degrees Fahrenheit or 37.5 degrees Celsius and a humidity level of 55 to 65% for the first 25 days. During the final 3 days, increase the humidity to 80%. And don't forget to turn the eggs 3 to 5 times daily to prevent the embryo from sticking to the shell. Soft-shelled eggs are caused by a lack of calcium in the diet. To address this, provide crushed oyster shells or limestone to supplement their calcium intake. Egg binding occurs when a duck has difficulty laying an egg, so make sure your ducks have a stress-free environment and a balanced diet to help prevent this issue. Although Pekin ducks are not typically broody, if they do become broody, they may stop laying eggs. To discourage broodiness, remove eggs promptly. Duck eggs have a thicker shell than chicken eggs, making them more durable and longer-lasting. They are a popular ingredient in Asian cuisine, often used in salted or preserved egg dishes. Duck eggs are often preferred by people with chicken egg allergies, as the proteins in duck eggs are different and may not trigger the same allergic reactions. If you have more eggs than you can use, consider selling them. Duck eggs are a niche product and can fetch a higher price than chicken eggs. Package the eggs carefully to prevent cracking during transport. And of course, clearly label the eggs as duck eggs and include any relevant information, like if they are organic or free-range. To maximize egg production in Pekin ducks, it's important to provide a balanced diet. Feed them a high-quality layer feed with at least 16 to 18% protein. Also, ensure ducks have constant access to clean water for drinking and bathing. Lighting plays a crucial role too. Provide 14 to 16 hours of light daily during the shorter days of winter to encourage laying. And of course, minimize stress by providing a safe, comfortable environment and avoiding sudden changes. Pekin duck eggs are unique and have several distinctive characteristics that set them apart from other types of eggs, such as chicken eggs. Here's a detailed look at the key features of Pekin duck eggs. Pekin duck eggs are larger than chicken eggs, typically weighing between 90 to 100 grams or 3 to 3.5 ounces. This makes them about 20 to 30% larger than a standard large chicken egg. The shells of Pekin duck eggs are usually white or off-white, though the color can vary slightly depending on the individual duck and its diet. Duck eggs have a thicker and tougher shell compared to chicken eggs. This makes them more durable and less prone to cracking, but it also means they can be slightly harder to crack open. The yolk of a Pekin duck egg is larger and richer than that of a chicken egg. It has a deeper yellow or orange color, indicating a higher concentration of nutrients like carotenoids. Duck egg yolks have a higher fat content, which contributes to their rich flavor and creamy texture. The egg white of a duck egg is thicker and more gelatinous than that of a chicken egg. It contains more protein, which makes it ideal for baking, as it helps create a fluffier texture in baked goods. Pekin duck eggs are highly nutritious and offer several health benefits. They contain more calories than chicken eggs due to their larger size and higher fat content. They provide a significant amount of high-quality protein, making them a great option for muscle repair and growth. Duck eggs are an excellent source of vitamin B12, selenium, choline, and iron. If the ducks are fed a diet rich in omega-3 fatty acids like flaxseed, their eggs will have higher levels of these healthy fats. Pekin duck eggs have a richer and creamier flavor compared to chicken eggs. This makes them a favorite among chefs and home cooks for dishes where the egg flavor is prominent, such as omelets, custards, and baked goods. The thick egg whites and rich yolks make duck eggs ideal for baking, producing moist and fluffy cakes, cookies, and pastries. Duck eggs are delicious when fried or scrambled, offering a richer taste and creamier texture. Hard-boiled duck eggs are creamy and satisfying, though they may take slightly longer to cook than chicken eggs. Duck eggs are excellent for pickling due to their size and texture. Refrigeration: store duck eggs in the refrigerator at 40 degrees Fahrenheit or 4 degrees Celsius or below. They can last up to 6 weeks when stored properly. Protective bloom. Duck eggs have a natural protective coating called the bloom that helps prevent bacteria from entering the shell. Avoid washing the eggs until you're ready to use them to preserve this coating. Duck eggs are often a good alternative for people with chicken egg allergies, as the proteins in duck eggs are different and may not trigger the same allergic reactions. However, always consult a doctor before trying duck eggs if you have an egg allergy. Pekin ducks are generally reliable layers, but like all poultry, they can experience egg-laying issues from time to time. Understanding these common problems and knowing how to address them can help keep your ducks healthy and productive. Here are some of the most common egg-laying issues in Pekin ducks and how to prevent or treat them. What it is: eggs with thin, soft, or missing shells causes calcium deficiency, a lack of calcium in the diet, poor nutrition, imbalanced diet, or insufficient protein. Stress: environmental stresses like overcrowding or predators. Prevention: treatment: provide a calcium supplement such as crushed oyster shells or limestone. Feed a balanced layer. Feed with at least 16 to 18% protein. Ensure ducks have access to clean water and a stress-free environment. Egg binding is a condition where a duck is unable to lay an egg, often due to a large or misshapen egg. Some common causes include nutritional deficiencies, such as a lack of calcium or vitamin D, obesity, and stress or illness. Symptoms to watch for include lethargy, straining, or a swollen abdomen, and the duck may sit in one place for extended periods. To prevent or treat egg binding, provide a balanced diet with adequate calcium and vitamins. Ensure ducks have access to clean water and a calm environment. If you suspect egg binding, it's important to consult a veterinarian immediately. Warm baths and gentle massage may help, but professional care is often necessary. Broodiness is a duck's instinct to sit on eggs to hatch them, which can cause a pause in egg production. This is driven by natural maternal instincts, though Pekin ducks are less prone to broodiness than other breeds. Symptoms include the duck refusing to leave the nest and becoming aggressive if disturbed. To prevent or treat broodiness, collect eggs daily to discourage the behavior. If a duck becomes broody, remove her from the nest and place her in a separate area with no nesting materials for a few days. Reduced egg production is a noticeable decrease in the number of eggs laid. Causes can include seasonal changes, with ducks laying fewer eggs in winter due to shorter daylight hours, age, as egg production declines after 2 to 3 years, stress from overcrowding, predators or environmental changes, and poor nutrition. To prevent or address reduced egg production, provide 14 to 16 hours of light daily during shorter days to encourage laying. Ensure ducks have a balanced diet and access to clean water. Minimize stress by providing a safe, comfortable environment. Misshapen eggs are those that are unusually shaped, wrinkled, or have ridges. The causes can vary. Stress, like environmental stresses or illness, can lead to these abnormalities. Nutritional imbalances, such as a lack of essential nutrients, can also be a factor. Infections or diseases, such as avian influenza or egg drop syndrome, might be the culprits too. To prevent or treat these issues, it's important to ensure ducks have a stress-free environment and a balanced diet. Always monitor for signs of illness, and if abnormalities persist, consult a veterinarian. Double-yolked eggs are, well, eggs with 2 yolks instead of just 1. This phenomenon is quite common in young ducks whose reproductive systems are still maturing. It can also occur in older ducks due to hormonal imbalances. Now, you might be wondering if this is something to worry about. The good news is double-yolked eggs are not harmful and can be eaten just like regular eggs. There's no specific treatment needed, but it's a good idea to monitor for any other signs of reproductive issues. Sometimes ducks may start eating their own eggs, often due to curiosity or nutritional deficiencies. One common cause is calcium deficiency. Ducks may eat eggs to replenish their calcium levels. Boredom or stress can also lead to this behavior, especially if there's a lack of enrichment or overcrowding. To prevent this, provide a calcium supplement and ensure the ducks have a balanced diet. Collect eggs frequently to prevent access, and consider adding fake eggs like golf balls to the nest to discourage egg eating. Prolapse is a condition where the oviduct protrudes from the vent after laying an egg. This can happen due to laying large or misshapen eggs, or from straining due to egg binding or obesity. Symptoms include visible tissue protruding from the vent, and the duck may appear distressed or lethargic. To prevent prolapse, ensure the ducks have a balanced diet and are not overweight. Providing a stress-free environment is also crucial. If prolapse does occur, consult a veterinarian immediately and keep the area clean and moist while seeking professional care. Egg drop syndrome is a viral infection that causes a sudden drop in egg production and results in abnormal eggs. Symptoms include soft-shelled or shell-less eggs and a noticeable reduction in egg production. To prevent this syndrome, maintain good biosecurity practices to prevent the spread of disease. If you suspect egg drop syndrome, consult a veterinarian for diagnosis and treatment options.